In a groundbreaking development that could shift the landscape of cardiovascular medicine, scientists have reported a dramatic reversal of heart failure in a large animal study using a new gene therapy. The therapy, which restores a crucial heart protein known as CBN1, not only halted the progression of heart failure but actively reversed some of the structural and functional damage in the heart. For the millions affected by heart failure, a condition long thought to be irreversible without a heart transplant, this research shines with rare, transformative promise. At the center of the study is the Protein Cardiac Bridging Integrator 1, or CBN1, which plays a critical role in organizing heart muscle cells and coordinating the signaling required for strong, synchronized contractions. When CBN1 levels fall, the structural and communication systems inside heart cells begin to collapse, which contributes to the progressive weakening seen in heart failure. Until now, treatments for heart failure have largely focused on symptom management, easing the burden on the heart, lowering blood pressure, and slowing the disease's progression. The new approach takes aim at the root cause, cellular disarray, and attempts to restore order from within. The researchers achieved this by using a common viral vector to deliver extra copies of the CBN1 gene directly to heart cells. Once the virus entered the bloodstream, it traveled to the heart, inserted the gene into the cells, and triggered them to begin producing healthy levels of CBN1 again. The results were nothing short of remarkable. In a controlled experiment involving pigs, a large animal model with cardiovascular systems closely resembling humans, all animals that received the gene therapy survived for the entire 6-month duration of the trial. This is especially significant, given that heart failure in this model typically leads to death within months. What makes this even more extraordinary is not simply the extension of life, but the measurable and visible restoration of heart function. Key indicators, such as the heart's ability to pump blood effectively, showed a 30% improvement, far surpassing the typical 5 to 10% gain seen with even the best pharmacological treatments. The treated hearts began to look and act more like healthy hearts, resisting the classic signs of heart failure such as thinning and dilation. This suggests not just a pause in disease progression, but actual healing, a concept long considered out of reach in chronic heart failure. The microscopic architecture of the heart cells also revealed compelling changes. Under fluorescent imaging, previously disordered structures in the failing hearts began to show signs of realignment. The heart cells regained the organized striations and alignment typical of healthy tissue, pointing to what scientists call reverse remodeling. In essence, the gene therapy didn't just prop up a failing organ. It appeared to guide the heart back toward its natural, functional form. The deeper strength of this therapy may lie in CBN1's unique role as a master regulator. It doesn't just perform one task. It acts as a scaffolding protein, helping orchestrate the placement and behavior of other proteins vital for muscle contraction and cellular signaling. Because it coordinates so many aspects of heart cell function, restoring CBN1 may have a domino effect that repairs widespread cellular dysfunction. It's this multifaceted benefit that gives the therapy such powerful restorative potential. The implications for human treatment are enormous. More than 6 million Americans currently suffer from heart failure, and that number is expected to rise as the population ages and metabolic disease rates climb. If even a fraction of the effects seen in this study can be replicated in people, gene therapy could move from the fringes of cardiovascular research into a central role in treatment plans. It could make heart transplants less necessary and offer hope to those for whom current drugs provide little relief. Of course, the path to clinical application is still in progress. The research team, in partnership with biotechnology company Tikinlev Therapeutics, is preparing for toxicology testing and hopes to seek FDA approval for human trials later this year. Safety remains a critical concern, especially in the world of gene therapy, where the use of viral vectors raises complex questions about immunity, long-term effects, and rare but serious side effects. It will also be important to determine whether patients who already have natural immunity to the viral carrier can still benefit from the treatment. Yet the scientific community is cautiously hopeful. The use of a large animal model gives this research far more weight than typical early-stage studies in rodents. The similarity of pig cardiovascular physiology to humans strengthens the case for eventual translation into human medicine. And the data, showing not just survival, but improvement, offers a new vision of what's possible. This breakthrough also underscores a broader narrative emerging in modern medicine, one where diseases once labeled chronic and irreversible are beginning to yield to treatments that engage the body's own mechanisms of repair. As our understanding of cellular and genetic systems deepens, therapies like this one offer a glimpse of a future in which medicine is not just reactive but regenerative. For patients living under the constant weight of a diagnosis like heart failure, hope has often been a rare commodity. But this research brings with it not just optimism, but a tangible sense of progress. It's a signal that we are entering an era where even the most entrenched diseases may be confronted with tools that heal at the root level. It is, as the researchers themselves describe, an unprecedented recovery. But more than that, it's a reminder that the future of medicine may be built not just on pills and procedures, but on the body's own blueprint for healing, rewritten with care and extraordinary precision. Would you like a layperson-friendly version of this article to share with family or friends?